melanocyte to melanoma. Melanocytes are cells that produce melanin, a brown-black pigment that determines the color of the skin, hair, and eyes in humans, and helps to guard against the damaging effects of the sun. In the skin, melanocytes are positioned at the epidermal-dermal junction, appearing as round cell bodies with long irregular extensions called dendrites. The formation of melanin occurs in the cell body, in an intracytoplasmic membrane-bound organelle called the melanosome. Next, the melanosome is transported by microtubules toward the surface of the melanocyte to a neighboring keratinocyte. Melanosomes are then released into the matrix of the cytoplasm in the keratinocyte and accumulate in the supranuclear region of the cytoplasm, thereby protecting the nuclei of dividing cells from the damaging effects of the sun. Several factors such as heritable predisposition and genetic mutations increase the risk of malignant melanoma. Ultraviolet UV radiation, such as that emitted by the sun, is directly absorbed by DNA and is a major risk factor for all types of skin cancer, including malignant melanoma. When UV radiation is absorbed by a double bond in a thymine base, the double bond opens, allowing the base to react with nearby molecules. If a UV-modified thymine base is adjacent to another thymine base on the same DNA strand, the two molecules can form a thymine dimer as a result of covalent bonding. The reaction most often involves the formation of two new bonds between neighboring bases, yielding a four-membered ring. The structural consequences of a UV-induced reaction include local distortions in the helix and a kinking in the DNA strand. If UV-related damage is not corrected by molecular repair mechanisms, DNA transcription and replication are blocked, and genetic information may be permanently mutated. Genetic mutations in melanocytes are associated with histologic changes along a continuum that may culminate in invasive malignancy. The transition from a normal melanocyte to metastatic melanoma may involve several histologic intermediates, including atypical dysplastic nevus of varying stages of severity, or melanoma in situ, and invasive melanoma. Indeed, melanomas diagnosed and treated during the radial growth phase have been shown to have an excellent prognosis. Currently, there is no cure for late-stage melanoma. As a result, early detection plays a critical role in reducing melanoma morbidity and mortality. New diagnostic tools to complement the visual examination of lesions, especially early-stage melanoma and borderline lesions, and those that lack the classic appearance of melanoma, could significantly enhance the detection process.
A diagnosis of the potentially fatal skin cancer known as melanoma can be alarming, but it can help to understand the options for treating this disease. Melanoma, a cancer of the skin's melanocytes, affects over 60,000 new Americans annually. Melanoma that spreads to the body's vital organs can result in death, but people who are diagnosed and treated early have a 95% chance of survival. Before melanoma can be treated, it must be classified. Doctors organize melanoma into 4 stages based on the tumor's thickness and its movement throughout the body. The first 2 stages of melanoma are known collectively as early melanomas. These tumors are not very thick and haven't spread far into the body. If a melanoma tumor has spread to the lymph nodes, the diagnosis is a stage 3 or stage 4 melanoma. A stage 3 melanoma is one that has spread to a lymph node near the tumor site. A stage 4 melanoma is one that has moved to lymph nodes further away from the tumor or to the lungs, liver, or brain. Regardless of classification, the first step in treating melanoma is a procedure called excision, which consists of surgically removing a tumor and about 3/4 of an inch of skin around it. For people with stage 1 and stage 2 melanoma, excision is often all that is needed to eradicate the cancer. These patients will still need regular follow-up visits with a doctor to ensure that melanoma doesn't return. For patients with a stage 3 or stage 4 melanoma, excision may be followed by an additional therapy designed to remove the cancer from any other places where it has spread. One of the most commonly used therapies for advanced melanoma is immunotherapy. Immunotherapy drugs like interferons and interleukins are injected into the body to help its immune system destroy cancer cells. Another treatment for advanced melanoma is radiation therapy. This procedure uses high-energy X-rays to kill cancer cells. Because radiation therapy is expensive and lengthy, it is usually only used for patients who have stage 4 melanoma or for patients who are not good surgical candidates. Chemotherapy is a form of melanoma treatment in which a variety of drugs are used to eradicate cancer cells. This procedure is usually performed in cycles to allow a patient to recover from the side effects. People with advanced melanoma on their arms or legs may undergo a type of chemotherapy called isolated limb perfusion. In this treatment, chemotherapy drugs are injected directly into the bloodstream of the affected limb. Research is currently underway to find new treatments for melanoma. Sometimes patients with advanced melanoma opt to participate in experimental trials to help find new cures. Melanoma can be frightening, but there are a number of treatments to help patients get the care they need. Please talk to your doctor about the treatment that is best for you. Want to learn more? Check out other videos and sources on this site for more information.
Washington, Oregon, and Idaho are all considering bills that would make it illegal for minors to use tanning beds. In tonight's Health Link, we meet a young woman who regrets the day she first walked into a tanning salon. Jean Anderson tells us why she's making a special appeal now.
This was 2003 or 2004, so you don't look old.
Ashley Trenner used to think a bronze glow made her look younger. That's why she was so determined to keep it year-round.
That I used to say, I don't care if I die from tanning as long as I die tan. I used to say that. I don't think that way anymore.
When we first met Ashley back in 2011, she was already on her third clinical trial, battling melanoma, the most deadly kind of skin cancer, traveling to and from Portland every week, desperately hoping this time she'd finally beat it for good. Last May 16th, a major milestone. Ashley celebrated the big 4-0 with her parents, Bob and Karen, and a crowd of friends.
I think there were about 100 people there, and they just had a grand time as we did celebrating her 40th year, thinking that, she may not make 41st.
9 months later, the tumors are too numerous to count.
Head to about right here. That's where most all of my pain is. All the tumors are in pretty much that area.
It's the end of a journey.
So as far as treatment right now, done.
Ashley has called a truce with cancer, but not with tanning beds, and she wants to warn everyone who will listen.
I paid money to be in the position that I am in now. I mean, it wasn't like I just wanted to be tan. I literally was paying someone to get this terrible disease, and that's killing me. That is killing me. Terminal.
Even the standard, one day at a time, no longer applies in this household.
Half a day at a time. When we met with the doctor before we brought her home, which was 3 weeks ago, he said she has weeks to live.
Ashley's now hooked up to pain medication, confined to bed.
One there, and then one there, and then a little one right there.
Tumors have paralyzed the right side of her face.
So I try not to smile at you. Sorry.
But she hasn't given up on style. Those nails.
Wonderful people that come do my nails and toes.
Those eyelashes. In typical Ashley fashion, she insists it's not over till it's over. Besides, she still has her will to finish.
It's hard. It's not easy to do. I'm not going to lie.
Not for the reason you might think.
I want to be fair to everybody.
Also typical Ashley, and don't get her wrong, she's grateful too. If not for cancer, she might not have mended her relationship with her parents.
Through that blossomed a beautiful relationship that I wouldn't trade for anything. Anything. So I say, yes, it took cancer to get us to where we are, but I wouldn't change that.
So sad time, but a special time. It's kind of a bittersweet time for us and our family.
As for Ashley, she has only one last wish.
If there's one person's life that I can affect, then that's a beautiful gift that I could give to somebody, because I don't want them to end up like me at all. It's just not worth it. I can't express that enough. It's just not worth it.
I'm Jean Anderson, King 5 HealthLink.
Ashley was first diagnosed with melanoma more than 7 years ago at age 33. She started tanning as a teenager.